A panic attack feels like dying. It isn't. And once you understand what's actually happening in your body during one, you have a chance of getting through it without that terror. I want to start by drawing a clear line between two things that often get talked about as if they were the same: anxiety and panic. They're related, but they are not the same experience, and the difference matters. Anxiety is a chronic, low grade activation. It's the tightness you carry through your day, the 6 out of 10 hum that doesn't quite go away, the bracing, the mental loop. Anxiety can last for hours, days, weeks. It's a pattern. A panic attack is something different. A panic attack is an acute spike. It hits suddenly, peaks within 10 to 15 minutes, and then drops back down. From the inside, it feels catastrophic. Heart racing so hard you're sure something is wrong with it. Difficulty breathing, tingling in your hands or face, sometimes a sense that you might pass out or lose control or die. People often go to emergency rooms during their first panic attack because it feels so much like a heart attack or a stroke that they're sure they're having one. What you need to know is this: in the vast majority of cases, a panic attack is not dangerous. It feels dangerous. The sensations are real and intense and not made up. But the underlying mechanism is your sympathetic nervous system firing extremely hard for a brief window of time. It can't actually hurt you in the way it feels like it can. Of course, if you've never had your symptoms checked out by a doctor, you should. Some symptoms can have medical causes. But if you've ruled that out and you're having panic attacks, what I want to share with you is what's actually happening and what to do. Here's what's happening in your body during a panic attack. It usually starts with a small change you may not even consciously notice: a tight breath, a skipped heartbeat, a flicker of fear. Your nervous system, on the lookout for threat, picks this up and interprets it as evidence that something is wrong. So it fires the fight or flight response. Adrenaline floods your bloodstream, your heart rate spikes, your breathing speeds up. Now here's the catch. You notice the spike. You notice your heart racing, your breath shortening, the tingling starting in your hands. And because you don't know what's happening, your brain interprets these sensations as evidence that something is very wrong, which triggers more sympathetic activation, which produces more sensations, which gets interpreted as more evidence of danger. The loop tightens. Within a minute or two, you're in full panic. The hyperventilation piece is particularly important to understand. When you breathe fast and shallow, you blow off too much carbon dioxide. This changes the pH of your blood, which causes the tingling in your hands and face, the lightheadedness, the sense of unreality. These symptoms are not signs that something is wrong with you. They are signs that you are breathing too fast. They go away when your breathing normalizes. And here's the genuinely good news. A panic attack, unlike a chronic anxiety state, has a built-in time limit. Your body cannot sustain that level of sympathetic activation for very long. Within 10 to 15 minutes, the cortisol and adrenaline begin to clear and the spike comes down. You can ride it. You don't have to do anything special to make it stop. You just have to not feed the loop. The way you feed the loop is by interpreting each new sensation as more danger. The way you stop feeding it is by reminding your body that the sensations, while intense, are not actually a threat. This is why people who have had many panic attacks often describe their experience changing over time. Not the intensity of the sensations themselves, but their relationship to them. They learn that the wave will crest and pass. They stop bracing against it. The panic still comes, but it loses its terror. What do you do in the moment? Two things, in this order. First, name what's happening. Say it out loud or in your head. This is a panic attack. It's intense. It will not last. It is not dangerous. Naming activates the prefrontal cortex, which can begin to regulate the amygdala. It interrupts the feedback loop that says something is wrong with information that says, I know what this is. Second, ground in your senses. The technique called 5 to 4, 3, 2, 1 is one of the most reliable in-the-moment grounding tools we have, and it works because it pulls attention out of the catastrophic interpretation and into the present moment reality. It goes like this. Look around and name 5 things you can see, out loud if possible. The lamp, the window, the cup on the table, the pattern in the rug, the hand of the person next to you. Then 4 things you can physically feel. The chair under you, your feet on the floor, the fabric of your clothes, the air on your skin. Then 3 things you can hear: the hum of the refrigerator, a car passing, your own breath, then 2 things you can smell, then 1 thing you can taste, even if it's just the inside of your mouth. This sounds simple, and it is. That's why it works. The simplicity is the point. Each item you name is a small piece of evidence that you are here, in this room, in this present moment. The catastrophic interpretation needs your full attention to keep going. When you give your attention to your senses instead, the loop weakens. 3 to 5 minutes of this, while you let the wave crest and pass, is often enough. The grounding I just walked you through is one of the best in-the-moment tools we have. But there's one practice that goes deeper, that doesn't just interrupt the panic loop, but actually rewires the system that produces it. It's a specific way of breathing, and most breathwork advice misses one critical detail. The full breakdown is in my next video. Links right here on screen. Take care of yourself. If you're in crisis, please reach out to a professional. And I'll see you there.